I think it's been extraordinary to have people not only from around Australia, metro, rural, regional areas, but we have some Singaporean guests and a New Zealander guest as well. So it's lovely to see the range of people and the different cancers people have experienced, health professionals, researchers, and consumers, carers, family members. So do we feel unlocked from patient to partner, unlocking the power of consumer engagement? We started off this morning looking at language, and I think there was a resonance in the room that the word consumer might not always be quite fitting. So we heard people discuss team members, just the community at large, or even people with lived or living experience. I tend to think it's more living. I don't know about you, but I'm 18 years down the track from a breast cancer diagnosis, and there's still things popping up all over the place. It's certainly an unfolding life, isn't it? We talked about communication, and it might have been KP who talked about curiosity and respect needing to underpin consumer involvement or consumer engagement. And I think that's something we should all walk away with from today. A healthy dose of curiosity, asking questions, not always having the answers, but together we're more likely to if we talk. We looked at, sorry about this folks, there we go, how we can embed consumer participation or team member participation in everyday business as usual. So that's looking at things like reducing the challenges and the barriers so that we can have more diversity at the table and ensure access to people who might be underrepresented because of financial, social barriers, confidence, self-efficacy, all those sorts of things. I think it was Dr. Kefford who talked about the fact that things always need to be patient and person-centred, nothing for us without us, and that we need appropriate systems and processes in place, looking at things like timing of consumer involvement. And look, personally, I've been delighted to see co-creation becoming part of the agenda. When I came on board as a consumer representative, it was more about consulting or even informing, but to see that we're actually at the table at the very beginning and co-creating the kind of health system that we want and the research topics that we want on the table is just fantastic. We looked at the importance of building relationships and as Navina said, that they're not always needing to be clinical or professionally based, just talking about non-project things is really important. Getting to know people personally because this is all about people. Also building networks is important. I think days like today that bring us together do that beautifully. We've talked about seeing consumers as equal partners to add dimensions just beyond the clinical. The fact that we've got physical, mental, emotional, spiritual, geographical, financial things going on all the time. We're very multifaceted creatures living in a very multifaceted world. So the clinical alone will never cut the mustard. And I think days like today, it's important to talk about how research translates into policy and practice. At the end of the day, we want the coalface when a healthcare professional is with a person in front of them, that's where we see the changes happen. That's really where it counts. So where to from now? We talked about prioritising our work and making sure that we continue to know what's important, continue to reduce the gaps, particularly for underrepresented people or people who can't speak very clearly or have the confidence to speak for themselves. We've talked about building on social capital and finding ways to diversify. I think what Jill said earlier about the PhD, the personal history of disease, meeting the PhD academically is really important so we can keep that curiosity and respect going forward and ensuring that education is the cornerstone to both the consumer world and the research world. Thank you.